Take
Oh,
one.
Okay. Come into the room, do my hand hygiene. Hi, Mr. Joe, how are you? I'm Gilda, and I'm going to be taking care of you today. Can I get you to tell me your name and date of birth?
John Doe 111.
All right, looks like that matches. You had surgery, didn't you?
Sure did.
Well, the physician has ordered, your surgeon has ordered us to go ahead and do a clean dressing change on you. So if you don't mind, I'm going to go ahead and take a look at your tummy, and I have all my supplies and everything here ready to set up. You ready?
Okay.
Okay. All right, incision looks good. How's your belly been feeling?
Good.
Have you been having any sharp or stabbing pain or any kind of discomfort that you want to tell me about?
Not at the moment.
Okay, good. So just on a scale of 1 to 10, does that mean that you have 0 pain right now?
I'd say a 1.
Okay, all right. So this is your drain, and what I'm going to do is I'm going to go ahead and get ready to measure what's in that drain. They've been emptying it for you about every shift, haven't they?
Yes.
Okay, all righty. Here's my little cup. Yeah, I might have made a little mess there. Okay, so I'm going to set this down. That looks like about 10 milliliters on there. Okay. All right, now we're going to take your dressing off, okay? And I'm just going to peel it back from the edges real gently. Use a little counter pressure traction here. Pull this up. How you feeling?
Good.
All right, I'm not hurting you, am I?
Nope.
All right. Okay. Well, your dressing looks pretty good. Wound edges are well approximated, and I see all the staples in place. Looks like the drain's coming out okay. I'm going to put this in the trash can. It has to be right there. All right, so next what we're going to do is we're going to set up a tray over here to clean the area, and then we're going to put another dressing on there, okay?
Okay.
So just bear with me here for a minute. Take these off. Hand hygiene. I don't have to have on exam gloves to open up a sterile pack, okay? Because I'm just touching the edges of this. I don't have enough room for my gloves.
Oh, Mom.
All right. I'm not turning my back on that, still watching. All right, before I get too entrenched in that, it's about 7.5 centimeters long.
Question, why didn't you have your gloves on before you measured it?
I didn't touch him. Right? I'm just holding it right here. Okay. All right, so. Oh, can't use that one. Okay, got one. What else do I have here? Okay, anything else I need? I'm gonna need, there we go, okay.
Yeah. Are those the saline ones or iodine ones?
These are saline,
Okay. Do you want me to just throw those up there?
not yet.
Okay.
Okay, I like to lift my hands up and away so that the fingertips don't have any possibility of dragging or anything down there. All right. Okay, and my betadine I just threw off. All right, here we go. Now I'm going to be touching you, and this may feel a little bit cold, okay? Trash. Trash. didn't touch anything up there. That was my trash. All right, so now we're going to go ahead and we're going to put this dressing on. Good. Okay, so what you noticed is that I did not necessarily put that dressing, that big blue drape down there. If your teacher showed you how to use the blue drape, that's fine. You should tuck it first, just like I was showing Berlinda. Berlinda, no,
Audrey.
Audra. And then I would take another piece of paper, write my name, date, and initials, place it on here. My hands are now covered with a clean exam gloves.
Would you take your gloves off and wash first?
My hands are now clean exam gloves. The magic of walking across the room. Okay, so what we're going to do is, we do have a specimen that we're going to get rid of, take to the lab in a little bit. So what do I need?
So we're just pretending this is the same patient?
Yes. We're saving me some time. Okay, so I'm going to open this. Okay. Pick this up. Okay. Come back here. Okay. And trash. Nope. Get another one. Okay. I can't get that on the field sterilely. So this is what I'm going to do. I'm going to lay right here. And somebody has put this together. I have to undo that. It's supposed to be in two pieces, just like that. So it's going to be laid right there. All right. I'm going to. And I'm circling right. Okay. Okay. Peel pack. Bink. Peel pack. Bink. Peel pack. Bink. What else do I need? Nothing else. Okay. Hi, it's Gilda. I don't do it with gauze.
We're not good for that.
I will if you want me to.
But we're not bandaging it, right?
No, not bandaged. All right. Hi, we're going to be working on your leg here, okay? Thanks for turning over for me. I'm going to put these blue things around here. They'll already be in place for you. And we're just going to rip this dressing off. Peeling it back gently. All right. Have a little bit of drainage on there.
What would you say the name is?
This is sanguinous, okay? It's bright red, pretty much saturated. Okay, so I'm going to save this dressing because I'm going to use it later, but I'm going to say I'm putting this in the trash can. And I've got my trash can right down
Would
here.
that be bio?
Biohazard. Yes, because if I squeeze that, it would drip.
What are we using as a biohazard bag?
Huh?
What are we using as a biohazard bag? Are we gonna have one there for us already?
Like this.
Oh, someone said it was
It'll
for
be one
specimen.
like that.
Okay, so I'm going to. Okay, I've got about 11 centimeters long, 3.5 centimeters wide, about a centimeter deep. Trash. Okay. All right. So she's going to tell me that this is where you guys are being taught to do this, right?
Mm-hmm.
Dip in your saline, and you're going trash. Okay. About an inch to 2 inches, right? All right. Now, if I had my other 4x4 to blot it dry, I would blot this dry. Then,
Do you have to turn it when you blot it?
if your instructor said you do, you do. All right. So after irrigating, I'm going to take this piece out. It's separate. I'm going to go into the deepest part of my wound, and I'm going to give it a good spin. Then I'm going to take this hand, lift the lid off with the heel of my hand, and without touching anything else, I'm going to let that go down in here. Squeeze this. I'm going to label it with the specimen culture label and put it in my biohazard bag. I'm going to hand it to my CNA to walk to the lab. I'm done. Is it 20 minutes yet?
It was 11 minutes.
12.
11 minutes.
So, if we got checked off on the specimen in lab, we just stop where?
If you got then you're done. You
You
don't
just
have
stop
to
after
culture
the irrigation?
Mhm.
Okay.
Yeah.
And
And
then
different
just-
different instructors did it
Yeah,
differently.
yeah, she checked us off. So, and then just